bear with me for a few minutes. We're going to have fun today, and we've already started having fun. So I really appreciate that you're all here. You may have noticed there's a lot going on. So we have resource tables set outside the room here that should be going for the entire event. The breakfast foods will be out till probably mid-morning. And I understand that we ran out of coffee. I apologize that we were not better prepared for that, but there's other beverages. The event is being recorded today, and we have a number of virtual attendees. So the recording will be available in the next few weeks through both the MHAM website as well as the NIHHC website. So look for more information on that in a few weeks. Bathrooms are just to the left, out the back doors. And lunch will be available around 12:15 for anyone who's registered for the full day or afternoon session. We based the food count on the number of people who registered. We have an amazing Spanish language translator, Suleya, with us today. So Suleya is in the back of the room. Thank you for being here. So the entire event will be available in Spanish for our Spanish language participants. Your feedback about the event is very important. So you should have received the evaluation link by email this morning. There is also, I think, a QR code. Let me make sure I have this right here. The QR code is on the table. So we've got these green sheets on your table. So what we would like to do is in between each session, we would actually like you to complete that evaluation for that session. We have a lot of content today. And so after each session, you'll be prompted to complete that section evaluation. And we're going to incentivize completing each section because there's going to be a $50 gift card available for every session completing the evaluation. So there are orange tickets on your page. Those are going to go into this jar, and there are table captains who can help you and who will be collecting the tickets. So if the table captains could just raise their hand. We don't have one at every table. Are there table captains in the room who are available to stand up or raise their hand? Okay. Okay, great. So you don't have to, you can just come up, walk up to the front and turn in the raffle tickets. But we're really wanting you to do it after each section. So our moderators will remind you of that. And then before the next session, we'll pick a winner. So if you're present, you'll have a chance to win. So the other thing that's important is that there is a green sheet in your programs, and this is a demographic sheet. So for our funders, it is important that they know that we be able to report out to them who is participating in our events. So this sheet, we invite you to fill it out and to turn it in. There is a container up here right next to me where you can put your demographic sheet. We are also incentivizing turning that in. This information is anonymous, but it's important for us to collect. And we appreciate your help filling that out. And there's also a chance to win a $50 gift card just by filling out the demographic sheet. And if you can, return that before the end of the day. I want to thank our event sponsors, First Source Bank, Bowen Center, and MD Wise. Please join me in thanking them for their support today. And I also want to thank the support for the Family and Social Services Administration for their support for today as well. Okay. I actually forgot to talk about the pipe cleaner. So on the tables, you'll see in the center a number of pipe cleaners. These are meant to be, for you to use if you're easily distractible. Rather than going on your phones or doing anything virtual, feel free to make creative objects. We don't have a prize for the most creative object, but feel free to brag to your table about what you've created. Okay, I think that's it for the logistics. Okay. All right. So I am delighted to welcome you to the 2024 Spring Immigrant Mental Health Summit, celebrating research, practice, and community resources reaching the immigrant population. My name is Lisa Kelly, and I'm Executive Director of Mental Health Awareness of Michiana, or MHAM. Our organization works to eliminate stigma around mental illness and remove barriers to mental health care in Michiana. We bring events like this one to St. Joseph and Elkhart counties to highlight mental health needs, but also to shine a light on great work that others are doing in the community to improve access to care and overall community well-being. Our organization values partnerships. We know that bringing in other people and perspectives makes for better and more inclusive events. This beautiful event is an example of how partnerships can expand our reach and increase our collective impact. 10 different organizations from St. Joseph and Elkhart County joined our planning committee. They're all listed in your program. We're very grateful for the work of the committee in pulling this event together. So if we could just extend thanks to the committee. Our partnership with Northern Indiana Hispanic Health Coalition has made this the most inclusive and accessible event that we have had. And I want to express my gratitude to Liliana for this opportunity to partner. I think you all will enjoy and be inspired at today's event. And I'd like to invite Liliana to the microphone to give a few words of welcome as well.
Thank you, Lisa. Good morning, everyone. Buenos días. ¿Cómo están? This is so excited to hear this Spanish participation. Really, this is what makes our community a stronger community. Thank you, Lisa, for your kind words. And it is a pleasure, really, to be here. My name is Liliana Quintero. I'm the Executive Director of the Northern Indiana Hispanic Health Coalition since 2004. I just wanted to say that has been an honor to be representing the voice, to be the voice of so many that are not here in the community. But this is not just me. This is thanks to the great team that I count on. I wanted to invite my team to stand up, the ones who were part of this. Kenny, Kumut, Natalie, Maria, Suleja. Really, thank you so much for believing in our leadership and for being here today. In June of 2002, Liliana Quintero came to South Bend, Indiana to study an MBA at ISB. When I was coming here, I had the same losses that many of our immigrants are feeling. I left my family, I left my dogs, I left my country, I left my friends, I left my job. I was an electrical engineer, I am an electrical engineer. I came here with my degree as an electrical engineer and my master in industrial engineering. When I decided to study my MBA, I asked my friends, other friends that had been in UK, United States, getting their master degrees, okay, give me some advice. I wanted to succeed. And they say, okay, don't worry. You sit down on the front row of the classroom and try to follow the lips of the teacher, because you can increase their understanding when you follow the lips. And that is something that is called syllabus. And the syllabus is going to tell you when the test is going to be, what are the assignments, right? What page you need to read, right? So you are good. Don't worry. Okay, happened that Liliana come to the first class, accounting. And I had one of the best teachers ever. And she arrived with a book in her hands, and I said, yes, it's a book. And she said, I don't believe in books. I don't like syllabus. I just come, you listen, take notes. It's like, oh my gosh. I got freaked out. I was next to a partner, American partner, and I approached and I say, oh my gosh, I'm nervous. Can I have your phone number? Because I knew that the class was once a week. So I didn't have anybody to contact. I don't have friends. I'm by myself. And his answer was, I am married. That was the start of my life in the United States. And why I bring this to the table? Because cultural sensitivity, and cultural awareness is the beginning of many of the mental health problems that we face. Thanks to me, thank God, I was a 30 years old person, professional. I knew what was the reason that I was in this country. I knew that I was coming here to succeed. And I didn't let that coming was going to draw me down and say, oh my gosh, I cannot approach anybody. I started learning about the individualism versus collectivism. I started learning like, oh my gosh, I'm on my own here. Thank God I met my Indian buddies, so they were as well working, used to work as a group, and we succeed. But I just wanted to invite today to everyone who is present here and think, how much are we doing to welcome these immigrants? How much are we doing to help that these people succeed? How much are we doing every day to really help them to overcome all the barriers, all the losses, and all the stress that they are facing? Because on top of that, we're talking of a young community that they are here on their own, and many of them are arriving without parents. So that is my invitation today, and it is an honor to be here and a pleasure to be here partnering with Lisa, MHAM, and hopefully this is going to be a beginning of a great day for all of us. Thank you so much.
Thank you, Liliana. So I'm honored to welcome our keynote speaker, Saulo Padilla. Saulo is the Mennonite Central Committee U.S. Migration Education Coordinator. Since 2008, Saulo has worked with the Mennonite Central Committee providing learning opportunities on the need for better and safer mechanisms for people facing migration and advocating for reforms to the outdated immigration system in the United States. He coordinates immigration law trainings for nonprofit organizations that provide immigration legal services to immigrant communities and leads learning trips to the U.S., Mexico, and Guatemala-Mexico borders. He's a facilitator for addressing the impact and trauma of migration seminars. He has co-facilitated migration trauma workshops and seminars across the U.S., Puerto Rico, Ecuador, Egypt, among other locations. He's a strategies for trauma awareness and resilience trained facilitator. His interest in addressing the trauma of migration stems from his own experience as the son of a political refugee and being an immigrant. He's a graduate of Anabaptist Mennonite Biblical Seminary in Elkhart, Indiana, with a Master of Arts in Theology and Ethics, and from Goshen College with a double concentration in History and Theology. Saulo, we welcome you today and are so happy that you're here with us.
Thank you, Lisa. Thank you so very much for the opportunity to be here this morning and to share with you. And I'm so delighted to hear also that we are paying attention on this subject. Often when I go to communities, the work that we do with migration is sometimes the basic needs, right? People need food, people need shelter, in education, work. But then sometimes we forget the mental health of people, and I think that's one of the important parts of this work as well, in that I'm celebrating that in the last few years I've seen more work going this route as well. So thank you for the people who are organizing this event, for the people who are supporting and sponsoring this event. I think this is a great way also of welcoming people and providing safety. When we talk about safety, let me ask a couple of questions, and I would like, in your table, if you can just turn to somebody and just ask a question or two. Do I have control of this here? Or, yes, it's on, but it's not working yet. Okay, so then, okay. Okay. So I don't have. Point to you. I'm gonna have to do this a lot. But just ask a question, maybe to somebody around you. When do you feel safe? What makes you feel safe, and do you feel safe? Just for a few seconds, talk to somebody beside you and just ask these questions. Welcome back. Welcome back. What are some of the things that are coming up? When do you feel safe? What makes you feel safe? Can you just raise your hand if you want? Yes. Friendly faces, yes. People that you trust. What else? What makes you feel? Yes. Home. Yes, home. What is home? Where is home? What else? Anything else? Yeah. Yes. Yeah. Familiar faces, familiar place. Yeah. Yes. Feel respected. Absolutely. Yeah. Feeling respected. Language. Yes. Yes. Yeah. I've been to places where I don't speak the language and I don't feel safe. It's one of the things, having access, right? It feels safe. We all experience safety in different ways. And safety means something different. At some point, people who are migrating may feel like food is the necessity they need to make feel safe. At some point, it might be water. At some point, it might be shelter. And depending on what is it that we need or where we are in the experience of migration, then something might make us feel safe or unsafe. And if we know anything about how we function in the brain, it's also that the better or the safer that we feel, the more that we go to the top of our brains, and that's where we are creative. That's where we're social, where we learn better, where critical thinking happens. But most of the time, people who are migrating, if they don't feel safe, then they'll be pushed down to the bottom of the brain. And that's where we are in the fight, flight, freeze zones of our brain. So for today, I want to also think about the communities that we work with, and do they feel safe? Do you feel safe? Are the communities receiving immigrants today, is our community, the citizens and residents, do we feel safe? Do we have the resources to feel safe? Because the safer that the receiving community feels, then the better it will be, the better prepared it will be also to receive other people. And the better that we will be practicing the welcome as well. So today also I have in mind the work of many people that I work with and that I have visited in different places. And migration today, we can talk about numbers, right? The millions of people who are migrating, people who are at the border right now waiting to cross. And we're making migration a very unsafe and dangerous route. The corridors of safety for migrants or people migrating today are closing and very narrow today. Policies and barriers, physical barriers, are creating very unsafe places for a lot of people to migrate. Last year, just alone in the Arizona desert, the remains of 197 migrants were found. That's only in Arizona in 2023. About 4,000 remains have been found in the last 2 decades. And we can go around and we can talk about the routes of migration in different places in the world and how unsafe it is for people to migrate today. To migrate today, to decide to move to another place today, is one of the most courageous things that a person can do. Because they're facing with a lot of unsafety in the way, and you never know if you're going to make it to the other side. Let me talk a little bit about a story of migration that I know well. And this is how communities and people have supported me along the way in the journey of my migration and what got me here today. This is me. This is 1970. I am 54 years old in 17 days. And I was a cute baby. Of course, you can see that. I don't know what happened. But I was born in Guatemala in the midst of a civil war in 1970. And my father was a student at a local university, and also he was a professor who was teaching veterinary medicine. And he was also a student finishing his thesis at the university. The university was very outspoken about social justice. We were also living in Guatemala City. And for the first 8 years of my life, I remember life being comfortable. I felt safe even in the midst of these conflicts. This is a picture of my 2 brothers and a cousin, and I am the one on the left. And I am around 8 years old in this picture. And up to this time, I remember feeling safe. Then in 1978, my father was protesting against some of the politics and some of the things in Guatemala City with other students, and he was kidnapped by the government. And he was tortured for about 2 weeks. I remember when my dad showed up the next time. This is a picture of my dad around that time. My dad showed up, and he had his eyes bloodshot and broken bones on his face. And he had been tortured and beaten up. So he had all those signs in his body. But also he had been traumatized by the experience and continued to receive death threats for the next 2 years. In 1980, in May of 1980, my dad, he was told by the government, if you don't leave Guatemala, we will kill you. So then he decided to cross the border and become a political refugee in Mexico. And he went in May of 1980, and then in August of that same year, then the rest of the family, my mother and 5 children, then we decided to also follow him and cross the border and become then refugees with my dad. So at the age of 10 years old, then I became a refugee with my parents. At this point in my life, I was in 4th grade. I was 10 years old. And they pulled me out of school, and then they put me in school in Mexico. And I started studying there, but then we only lasted about 4 months in Mexico. And my dad decided that he was going to go to Canada. And he was going to apply for refugee status in Canada, but the rest of us in the family, we have to return to Guatemala. So then we were returned to Guatemala, and my dad stayed in Mexico, and then a few months later, then he made it to Canada. But then for the following 6 years, we were separated as a family. One of the things that informs my work right now, and also as I connect with people in the school systems today, and some of the issues they're facing with children, especially in the schools and children of immigrants and of asylum seekers and refugees, is that we have provided a lot of the food, the shelter. They have homes, but we haven't dealt a lot with some of these issues of mental health. And a lot of the children are also living with a lot of the trauma of the migration and many of the things that the parents are dealing with, and a lot of the issues of children who are U.S. citizens, but they are dealing with parents who are undocumented or asylum seekers still feeling unsafe in our communities. So how do we support them? During this time, when I was 10 years old and I was in Mexico, they were trying to teach me my timetables, and I couldn't learn them. And people then started telling me, you're dumb, you're not smart. I was hit many times because I didn't learn my timetables. And I wasn't in the top of my brain, right? I was in survival mode. What I remember from this time is that I used to, for some time, when we returned to Guatemala, my mom couldn't have the 5 children together, so then she separated us, and 3 of us, the older ones, we went to live in a little town with my uncle who had 5, 6 children, and then she stayed in Guatemala City with my 2 younger siblings. And then at this point, I went back to 4th grade. This is the 3rd time I'm in 4th grade. And then what I remember from that year is that I failed 4th grade again, that I had lice in my head, that they had to shave my head. I also used to wet my bed every single night. And I had this fungus in my feet that I could not get rid of. So I could not play. I used to look at the kids outside playing soccer, and I could not do that. And that's what I remember from that year. A lot of it is blurred in my brain, and my brain has done this thing of probably protecting me from the memories of that year. But I remember how hard it was to be 10 years old, 11 years old, and trying to make it through 4th grade. So a lot of the kids who are today in our school system, and Goshen Community Schools has, 58% Latino, Latina, sons and daughters of immigrants, asylum seekers. Then, and many of the administration and the teachers are having a lot of issues with them, and maybe we might think that these are kids who are not smart enough and who are not thinking well. And a lot of it has to do probably with their experience of migration and what they're facing in this experience. So this invites me to think and consider their stories today. What is happening with them? What can we do to make them feel safe in our community, in our school? So let me fast forward. 1985, 86 comes, and we hear that our documents to go to Canada are coming together. And in February of 1986, then we finally receive our documents, and we fly out. This is the first time we jump on a plane. We go to Miami, and to go to Toronto in Canada. And in one way, we're crying for our community. We're leaving behind and the family and the church community that we had in Guatemala. And the other one, we're very excited to go see my father, who we have not seen in 6 years. And at this point, then we arrived in Canada. It's February 19th of 1986. We left Guatemala. That was 23 degrees Celsius, about 73, and then we arrived in Canada, minus 25 degrees Celsius. So then life starts to change at that moment. And we arrive at the airport, and they start dressing us up as if we were going to the moon, because we just arrived in this new environment. And when we walked out, of course, we realized that cold, that just bitter cold that hits you in your cheeks, and then right away you realize you're in somewhere else. And then the weather changes, but also the way that we dress and the way that the food, right? We didn't know. Then we start asking questions, and people talk to us, but we don't want to understand a thing they're saying. So everything had changed for us, and we felt unsafe. And then the relationship with my father also, we had not seen him for 6 years. The last time I saw him, I was 10, now I'm 16. And when you are dealing with children in your school system or in the system here, when they're arriving and they're reconnecting with the parents after many years of disconnection, then what are the resources we have available for them? Because that has been a big disconnect for them. So how do we do that? There we go. So then we arrived in Canada, and we start navigating some of these issues. But my mom and my dad could not get along at that point. My dad was trying to make my mother stay at home. She wanted to work outside the house. Many other things that started happening with them, to the point of some domestic violence issues as well in there. And then my mom fell into a very deep depression. I think we as humans, we can handle stressors in life, right? Many things that we can, but then when they start accumulating one after the other, then there comes a point where we break down, and if we don't have the resources available, then things happen to us, and the issue of mental health starts showing up as well. So my mother fell into this deep depression. When we arrived in Canada, my mom was probably about 140 pounds. She was 4'7", and she was about 140 pounds. By the time she left, about a couple months after, because we could not find a doctor who could provide services in Spanish for her in Calgary, Alberta, in Canada, then she went back to Guatemala. And she was probably about 95 pounds. And at that point, she was losing her hearing in one ear. And she thought that somebody was doing witchcraft on her because of the things she was thinking and how was she feeling about several things. And I truly believe that if at that point somebody would have kind of stopped us a little bit and say, this is what you have been going through, and talk a little bit about our experience and the trauma we had experienced, but also sit down with my mom and think about her mental health. Because we had all the other things, food, shelter, we were in Canada. Do you think we were safe? However, my mother was not feeling safe. She needed to go back to Guatemala. So she went back to Guatemala with my sister, and at that point, then we stayed with my dad. My two brothers and I stayed with my dad. My older sister never came. She was left behind in Guatemala. She was already married, and so then at this point, the family was separated. So up to today, I have two sisters who live in Guatemala City. I have two brothers who live in Canada, and I live here in Goshen, Indiana with my own family. When we arrived in Canada, by the way, my mother passed away in 2018. And she died from many illnesses, diabetes, high blood pressure, heart issues, and the depression. And if you have read a book, The Body Keeps the Score, I think her body kept the score of many things that happened in her life. She was 70 years old, 71, and at this point, then her body started breaking down. The many things had accumulated to the point that she looked great. At the same time, she felt terrible inside for the many things, and especially her mind, her mental health was not doing so well. She always wanted to go back to those memories of the things that we had gone through and go over and over. And every conversation we would have over the table after a meal will end up in these hardships that she had gone through in her life. So one of the beautiful things that happened to us, we started looking for a community in Canada when we arrived, and we found a church. And this was a Mennonite church, and we didn't know what Mennonites or who Mennonites were. But we went to this church, and they said it's an evangelical Pentecostal Mennonite church. And it was a blend of all these things. The beautiful thing about this church is that people were from about 13 countries from Latin America. They all spoke Spanish in their own way, with their own accents. And also, we all had the immigrant or migration experience. Refugees, asylum seekers, people who had come in the last decade, they knew how to embrace the newcomer. So they took care of us. They became our interpreters, translators. They became a network for us, and many things that happened in that church. Something that also happened in that church was that the first meeting that I attended, it was a youth group, and then across from the room, there was this beautiful dark-skinned Salvadorian girl. She was 15, I was 16, and right away, I connected with her. And at the end of that meeting, I gave her my phone number. And then we stayed connected. And today, we have been married 36 years, and she's right there. But thank you. It's a beautiful love story, but I won't tell it today. But one of the things that this started providing for me, it was providing safety. This church, this community, this relationship, it started providing safety. It was in this church that our three daughters were born in the following years. So Sarah, Rebecca, and Vanessa. Rebecca's in the back there. And this is where the church where they were born, and this community embraced us. But also this community, when I dropped out of high school and started working as a young father, then this is the church that started giving me an opportunity to play music. So I became a worship leader. I became a youth leader in the church. Also, when I was working in different places, one of the beautiful things about today was when Lisa said my name, because for some reason people don't know how to say my name sometimes, so they don't try to say my name. So then I went to places, and I used to work in places, and my first job, I was a janitor, then I was a forklift operator, then I was a painter, and I was a cook. And then some people, as soon as I said, they asked me, what is your name? I said, Saulo. they will say, oh, we don't know how to say that name. We're going to call you Sally. We're going to call you Salamander. We're going to call you Mexican. We'll call you Pancho. We'll call you, and that continues, right? Microaggressions that we think are, but then we start shifting because after that, I changed my behavior and I didn't want to say my name sometimes because I felt ashamed of my name. And so thank you, Lisa, for saying my name today. But those are the things that sometimes, right? Microaggressions that people migrating that don't make them feel safe. So this church became this place where my name was said well, and they gave me an opportunity to be part of the community. And I had a place in this community. It made me feel safe. My language was spoken, and I started feeling well in this community. So we served there for 16 years. The other thing that this happened in this community was that at some point it became our network. After 2-3 years that I started working in all these jobs, I was unemployed. Our daughter Sarah was 2 years old, and I didn't have a job. And then somebody in the community tapped me on the shoulder, and they said, you should go look for a job. This skills training in this place, this community organization is offering this skills training for auto mechanics. You should apply for that. So I went, and it was for recent immigrants. I applied. The name of the organization was Mennonite Central Committee. This is the organization that I work for now. And they were offering this training. Out of that, I became a licensed mechanic. So I can fix your Toyota and your Lexus. By the year 2000, I was Lexus Technician of the Year for Lexus Canada, and I had this to prove it here. But I have been doing that job for many years now. And so then this community was also this tap on the shoulder, these places. At some point then in 1999, 2000, somebody came to me and they said, you know, you should go to study at Goshen College for the Hispanic Ministries program. So then I didn't have a high school diploma, but people in the church said, you should get your GED. So they pushed me through, and then I got my GED, sent it to Goshen College, and I ended up studying at the Hispanic Ministries program at Goshen College. Then here, being in the church, in the community, at Iglesia del Buen Pastor, here in Goshen, then somebody in there tapped me on the shoulder when I finished at Goshen College, and they said, you should go get a master's degree at AMBS. And at that point, I thought, oh, it's too much, we don't have money, but AMBS decided to give me a free ride in some ways, and they provided a scholarship, so I ended up going to AMBS. And then in 2008, as I was finishing with that at AMBS, then somebody in the church also said to me, you know, Mennonite Central Committee is hiring for the Migration Education Coordinator position. You should apply for it. And now I'm telling you this story 16 years later, working for MCC. But it has been the work of a community, of providing safety, these safety pockets, where I can see, right, and I can get to the top of my brain, and I can see myself, because no longer I carry the narrative that I was given when I was young and I was 10 years old, that I was dumb, that I couldn't think, that I wasn't smart. But this community has supported me and lifted me up in some ways to see myself in a different light. So today, I have 4 grandsons, and I also have a granddaughter. We do. And it's one of the most beautiful things that we have in life. But one of the things that I think is important for me, and I keep reminding my daughters and my grandchildren too, is that we are immigrants. We come from refugees and from immigrants. So in the future, when they hear this story, and then when they are 20 years old, and somebody talks about the immigrants, the illegals, the undocumented refugees, asylum seekers, they say, my grandfather was one of them. And this is important because in the United States, a lot of people have forgotten their stories, and we need to carry those stories forward with us to remind us, to connect us to other human beings who have experienced this and who are experiencing that today. So that's one of the biggest joys that I have today and the biggest challenges I have today too. But I also want my grandchildren to grow up in safe communities and in healthy communities. And this is the work that I need to do as well in bringing immigrant communities and also the local community together as well. So this is why I'm here today, and I'm very excited to be here today to share with you about some of this experience, but also how do we do this together? And how do we look at safety, the safety of people, finding finding safety and seeking for home is a long integration process. And how do we do that well? And also, how are we shortening it? At this point in life, after 38 years of being on the move in some ways and being a migrant, a refugee, I'm finally finding safety in Goshen, Indiana, right? Out of all places, in Goshen, little Goshen, Indiana. But that's where I'm finding community, when I'm finding safety. And then how do we also shorten those 38 years so that people feel safer in our communities now when we deal with the issues, the basic needs, but also the mental health? So more women that experience migration, like my mother, excuse me, don't have to go through this, right? They don't have to die young, and they can live full lives as well. And as we continue the work, and my grandchildren can live in healthy communities as well. So my question for you today then is, are we a safe community? Are we safe for people who are arriving today here? Are we safe for the local community? Because remember, if the local community feels safe, the better they will be equipped so they can receive newcomers. So that's my invitation for you today, to think about, are we safe? And if not, then what are the things that we can do to provide that safety for people who are arriving? Thank you.
So we have time for a couple of questions. So Saulo, if you can just stay for a few more minutes. Does anybody in the audience have any questions or comments for Saulo?
Liliana.
I would say,
Are we-
a welcoming community for the immigrants.
Yeah. I think with these steps that we're taking, we're becoming a safer community every time. I think that we have a lot to do, right? This safe, feeling safe for many people in the process right now. So let's take, for example, maybe a couple of people who are immigrants in our community. We have people who have been here for many years, who are immigrants, let's say, part of our documented community. We have DACA, people who have been here since they were kids, and then I don't know what it is or how it feels to live for 20 years of your life or most of your life, right, with that feeling that is my safety going to be taken away? This document be taken away, and what that does to a person that every time that is in the news or it's our politicians say something about DACA that's going to be taken away, then that brings us back to this feeling of feeling unsafe. So are we safe today in the community? Safety also encompasses the political, right? Everything outside. So we can feel safe physically, personally, but also then it encompasses the context and the political as well. So then for us to advocate for better laws, I think that's part of this work as well. So the basic needs, and then it grows into also, are we safe as a community for people here? Do they feel safe here? I will say yes. Probably, people starting to feel safe here, there are jobs here, but then what are the other things that we can do and advocate that we're learning from the community in Goshen as well? Yes.
Thank you so much for sharing your story. It's not easy, and so we just want to honor that. I guess my question is, as an organization, how do you, when you experience an organization, what makes an organization safe? Like, how can our organizations be safer?
Right. Yeah. So this question of safety, like, do you feel safe? I've been taking it with me to different places and been asking a lot of people, do you feel safe? And so I think it's something that also we need to figure out in our organizations, right? Do you feel safe here? Do we have the resources available that you need to feel safe? And that could be, once again, all the way from having the material resources to actually also access. A lot of our immigrant, we can have more access. I think having access, and I'm saying access in ways of when I have been giving access to processes to be part of the organization, not only as a token, but also to have a voice to change processes in the in my organization. That's where I have felt safer in my organization as well. So I would say in organizations as well, then asking the questions of safety, but even to the level of, yeah, do you feel safe here? Do you feel like you have a voice? Do you have access? And also, are we taking care of you in that way as well? Yeah. And also that we are in this, I will say, many of you are in the work of social services. And one of the things that I am finding today is a lot of people are facing burnout, compassion fatigue, and then because we are dealing with the darkness of the world in some ways, right? We're dealing with also a lot of these things, a lot of pushbacks in our work. So then finding ways of taking care of each other.
Así que busquen.
Self-care, I think, is one of the things that we really need to do, and finding ways that recognizing that when people in our organization are not doing well, not feeling well, how do we also provide them with resources so that they can take care of themselves? Yeah. Thank you.
Thank you so much. Okay, so we're having a short break, but now is your chance to win $50. So please take, the QR code or the evaluation link. And the key thing is, once you do the evaluation for this section only, take the orange ticket on the table, tear it in half, and you can either personally bring it up to the jar or you can hand it to one of the staff people who are walking around the room. And also, you still have a chance to do the demographic sheet, and I think that that can be turned into the staff people, or you can bring it to the container that's at the back of the room. Oh, it's being walked around. Okay, thank you so much, and we'll get started promptly at 10 o'clock. Thank you.